Hi, this is an educational video on ptosis correction using the frontalis sling. My name is Kami Parsa. The patient is a 5-year-old girl with a congenital ptosis on the left eye. On exam, she had 20/20 vision on both eyes. However, the left eye was starting to become amblyopic, and her palpebral fissures were measured to be 10 millimeters in the right eye and 6 millimeters in the left eye, with levator function of 5 millimeters in the left eye. So based on the levator function, which is the primary treatment plan, we determined that the patient needs a frontalis sling. So as you see, there are three, typically when I do this, and again we're using a silicone sling on this patient. The markings are three about 2 millimeter markings right immediately above the eyelid margin, about 2 millimeters above it, and 3 above the eyebrow in that respective planes as shown here. A 15 blade is used to make a skin incision over the pre-placed skin markings, and as you see in the bottom there's a protective metal shoehorn that's in place to protect the eyeball. Colorado's tip cautery is used to extend the incision. Now we use the silicone sling, and it comes with a needle itself. You pass it in a suborbicularis fascial plane as shown in this video, and now from the medial incision, the end is again in a suborbicularis plane. It's extended superiorly on the medial incision above the brow, and again from the temporal eyelid incision to the temporal brow incision, and we go ahead and pass this medially, and everything comes together in the central line. Now before you go ahead and tie that, I typically use a 5/0 vicryl to anchor the sling to the orbicularis, and we could go ahead and close the skin edges using an absorbable suture. Again, the sling is anchored to the orbicularis around, and we go ahead and then close the skin edges with an absorbable stitch. So once that is done, we need to adjust the height. So this is how you just adjust it as needed, and I typically go above the eyelid margin. Now we're using Now there are two options. You can go ahead and tie this the sling, or you can pass. What we're doing is a sleeve that allows this to stay open, and it's easier to later on if you need to do some adjustments, you can go ahead and open that sleeve. So each end is retrieved, and then once the proper height is set, you can go ahead and tuck the sleeve in underneath the central incision. We go ahead and close the skin edges. Now care must be taken to prevent any exposure issues on the eyelid, so make sure you put plenty of lubrication. Typically use an antibiotic ointment that's available. Now most of these skin incisions heal very well. In my experience, kids just heal incredibly well. And one thing about the sling, is that you need to explain to the parents when the child looks down, the eyelid is going to stay up, and that dynamic change is something that will never be there. And this is the post-op, pre and post-op picture of the patient. As you see on frontal view, the patient has perfect symmetry.